The views expressed in this podcast are solely those of the speaker and do not necessarily represent the opinions of the Consumer Healthcare Products Association.
Welcome to Chippa Chat, conversations in the consumer healthcare industry.
Welcome, everybody, and thanks again for joining us in a continuous series of topics important to the dietary supplement category. Today, we're going to talk about public health and the impact that nutrition and dietary supplements can have in public health, especially given the changes in the past 12 months in the pandemic. I'm really excited to talk to our next thought leader, Dr. Oscar Franco, who's professor of epidemiology and public health and the director of the Institute of Social and Preventive Medicine at the University of Bern in Bern, Switzerland. Oscar is also adjunct professor at the Harvard T.H. Chan School of Public Health and Erasmus Medical College in Rotterdam, a scientific advisor for the French television channel France 24. I wish I could say that in French. Sorry, Oscar. And then Oscar has been one of the most proliferative authors in the scientific world, and particularly a thought leader in public health with over 700 publications in high-impact journals. Oscar, my friend, it's great talking to you, and thanks very much for joining us today.
John, thanks to you for the invitation. For me, it's always a pleasure to talk about public health and to talk with friends like yourself. So thank you for the invitation and this opportunity.
So, Oscar, I've had the great opportunity and the fantastic experience of knowing you for something close to approaching 15 years. And one of the things I've always enjoyed is capturing your insight and better understanding the impact and the role that epidemiology can have in establishing health policy and helping us define the trajectory of what the world, in fact, or Americans should be talking about how to improve health practices. Give us, if you would, a little bit of insight of some of the top line and most important insights from the epidemiological world on what's happening today, especially kind of a through and post-pandemic and the impact on health practices that you're beginning to see take hold around the world.
Thanks, John. I think the pandemic is going to leave us with a lot of lessons, with a lot of positive things, a lot of negative things. We all have experienced the pandemic in a different way. It has affected our mental health, our capacity of living. But in terms of epidemiology, if anything, the pandemic gave us a number of lessons that we should have learned earlier. The first one is that patients are not patients, and patients are not clients. Patients are persons, and they live in families and communities. And if we really want to make a change, we are going to have to interact more closely with communities and improve the circumstances that communities are living. I think that's the number one. Epidemiology looks at large populations. It doesn't focus on individuals. It focuses on populations. And that's what we have learned in the pandemic. We are all in this together. Pandemic is a problem of everyone, and in everyone is the solution. That's the first thing. Second thing that has shown us the pandemic is that epidemiology can help a lot in sharing something that is very important for the population. I think that it has shown us that health, information, and education are very important resources that should be benefited and accessible to the majority of the population and not to just a few. And epidemiology can help in understanding how these populations, how the knowledge can be delivered to the populations and how science can be translated for implementation. I think these are two of the largest contributions that epidemiology can leave for healthcare and for the future after the pandemic.
Yeah, that's great. You know, in my own observation, Oscar, I've seen that probably now more than ever, the consumer is more motivated than ever before to find information, to understand better of what they can do and control themselves. And it usually starts with lifestyle and diet and nutrition practices and habits. But could you tease that out for us on lifestyles? What are important in lifestyles? And then, as you might also on, what are the most important things if you're going to improve your dietary practices? What should that include?
John, I think if I mention to you lifestyle, I'm preaching to the converted. What we have seen in the pandemic is, despite that the most important risk factors is being male, old, hypertensive, obese, and diabetic, if these are the most important risk factors for coronavirus and to have a worse coronavirus or to die from it, none of these diseases appear from one day to another, but they are the result of a number of lifestyle factors, a number of bad diet, not doing exercise, sleeping badly, having a lot of stress that have occurred day after day after day after day for years. Despite that, when we look at all the measures that are being taken to improve the health of the population or to prevent COVID-19, the majority of the measures are not talking about lifestyle. And that hasn't helped the consumer to be able to know what to do to prevent coronavirus. And I think the answer to this, and I said before, lifestyle is something that I don't need to convince you about, but I think we need to convince the population that if we want to have a good immune health, a good cardiac health, and a good metabolic health, lifestyle, not just nutrition, but not smoking, not drinking alcohol or drinking small amounts, controlling stress, sleeping well, and doing a lot of physical activity and vigilating how this lifestyle is incorporated is essential, not just for individuals, for communities, and for the government, not only to tackle this pandemic, but to tackle all future pandemics and the big important crisis that we are really facing, which is planetary health and climate change.
Chronic disease doesn't happen overnight. It's not like an acute symptom. I got a headache and it comes and goes, fairly quickly. Chronic disease is something that happens over time, but can be addressed with better lifestyles and filling, in some cases, the nutrient gaps that exist from poor practices. Is that a fair and accurate statement from what you were describing?
Totally agree, John. And an important aspect as well is not only that these challenges that we are adding to our organism by eating the wrong things or behaving in a poor way, not doing physical activity, all those challenges are accumulating, they're building up. So it's never too early to stop those challenges. But another important message is that it's never too late to change lifestyle. And what we see is that people, even after they have disease, even after they have spent many years smoking or eating poorly, etc., as soon as they change lifestyle, they start accruing the benefits of an improved diet or of doing physical activity. So the message that we need to deliver now is that maybe there could be a new pandemic coming. Maybe we are living already in a pandemic of cardiometabolic disorders. What are we doing to prepare to avoid the future pandemic and to diminish the pandemic that we are living right now from COVID-19 and cardiovascular diseases? Why aren't we investing more in improving lifestyle? And I think if we want to prepare in the future, we can start immediately, either for getting coronavirus in the coming months or years, or to prepare for the next pandemic. We need to improve our health by having a good, healthy lifestyle.
Oscar, you talk about like the investment, either in the investment as being committed to better health practices, but also an investment in healthcare systems. And I'm curious on what you think about this. Is that at least in America, it's difficult to get full recognition by insurance providers to support the use of better nutrition or lifestyle changes. Or even in the case where there are gaps in nutrition that could be solved in a transitional way with dietary supplements to support that for some periods of time. What will it take to get the healthcare system to be more serious about understanding preventive care and the use of appropriate tools and lifestyles that can be used to facilitate and accelerate better health practices? I know that, for example, you've been an advisor to a large number of ministries of health around the world. And I can imagine you talk about this a lot with them. But what do they see? Do they support these kinds of general concepts so that there could be greater investment in health systems within their own countries?
John, I think what we see worldwide is that healthcare is upside down. We still think that health is dictated by experts and specialists in a hospital. In hospitals, you can take care of disease, but you don't take care of health. If we want healthcare systems that really help the health of the population and not just to treat diseases, which is the model that we have right now, we need to turn the level of investment, research, and approaches to our population and have a population approach in which we are going to work on improving the lifestyle and behavior of the population in order to prevent that these people are going to be coming to hospitals to require very expensive medication, very expensive intensive care unit treatments. Right now, the system, the model is wrong. is focus on diseases, and this is healthcare. We are not taking care of health. We are taking care of diseases, and this needs to change. And what it takes to change, if it is not a catastrophe, if it is not a pandemic like the one we are living, I don't know what we need. I don't know how many more catastrophes do we need to be able to understand this, which I think the pandemic make it even clearer.
Yeah, to that end, Oscar, I know that you've been a contributor to the World Health Organization, the WHO's report on non-communicable diseases, which is part of what we're talking about here. But as you prepare those reports and provide those insights, are there one or two, three or four major insights that you learned from epidemiological studies related to nutrition practices that are really important? I guess maybe the way I should have asked this question is, what's the best diet in the world? Is the Mediterranean diet? You worked with so many cohorts that are well known to our listeners and had a chance to dive deep. What are you learning from the epidemiological and the cohorts that you have applied to the WHO report and in your discussions to ministers of health?
John, one of the things we have learned, and first, is there is no magical diet that is going to solve it for all of us. But there is one magical word that is going to help us all, which is moderation. Everything we do, everything we eat, everything we take, most of it is okay if we do it in low amounts or with moderation. And it's very important to adapt those to your local facilities. I cannot advise someone in Africa to follow a Mediterranean diet, or I cannot advise people in the United States to not to drink local excellent wines like the ones you produce. Why would you be drinking the ones in France, which are also good, but you have very good local products? I think we have in every community and every society, in every geographical location in the world, there are good elements of diet that are hanging out there that could be utilized. And following a model from a distant world, I don't think is realistic. I think moderation and application to the local circumstances and the local needs are essential to be able to provide that advice. And there is no magical pill. There is no magical advice. Just one magical word, and that is moderation within a healthy lifestyle, with lots of physical activity, trying to sleep well, not smoking, keeping an eye on what you drink and how much you drink, and trying to control your stress.
Yeah. In the United States, the USDA, the U.S. Department of Agriculture, released their 2020-2025 dietary guidelines. And they identify for the first time across very specific population segments the issue of nutrient gaps, where a good 40 to even as high as 60% of Americans have nutrient gaps. What's the cause of those gaps, and how can we fill them?
We've seen an excess in consumption of certain products that do not deliver the nutritional needs of the population. We've been maybe drinking too much carbonated drinks, or maybe we have been eating too many big burgers, and we haven't been having balance and moderation into our diet. So it's very important to go back to those local products that are really healthy and go back to eat how people used to eat in the past: fresh, local, and on balance. I mean, we have wonderful fruits, wonderful vegetables. America is full of fertile lands that produces amazing products. Why do we need to go for processed foods? Why can't we eat fresh and natural? And I think that is a very important message. So far, we have been complicating our own lives, eating things that we don't need, eating things that do not solve our needs. And now we're having gaps of nutrition while we are obese at the same time because we've been eating a lot, but a lot of things that do not deliver what we require. And now what we need to do is basically look at what are the type of behaviors we have created that are unnecessary, and can we actually challenge them? Can we actually change them? And can we fill in some of those gaps that we have created ourselves?
Yeah, great. One of the things that, as you know, in most of the conferences and seminars that we go to, especially when we're together and some of our colleagues in public health, we talk about this issue of the nutrient gap. And there can be no doubt, right, that the best way to fill that is with better dietary practices and habits and better food choices and knowing what to shop for when you go to the farmer's market or to the grocery store. But more and more science is beginning to show that while vitamins and minerals may be important, they're not necessarily going to provide the final solution, but it needs to be used also with a complete, almost like a whole food approach into using active phytonutrients and vitamins and minerals and other components that provide a better nutrient profile. And I know there's a lot of research, and you've done some research too in looking at phytonutrients, and especially with the interest in Switzerland, there must be some interest in work that you've done in your cardiovascular world on cocoa polyphenols in some of these, what I call phytonutrients that play an important role, which also was part of the discussion when people do talk about Mediterranean diet. But how do you feel about all these nutrients and ingredients that the population is essentially bombarded with? And should they be considering about that when they think about moderation and the foods they do pick to consume?
Yes, John, the population has been bombarded with commercial products that not necessarily are accompanied by the adequate science. And I think science plays a very important role, and in that sense, epidemiology, nutritional sciences are going to play a very important role in clarifying what is good for people and what is not. We have seen during this year, we have witnessed a miracle of science, which is to have a pandemic and to have 9 vaccines that we have right now that seem to work within a year. We have never seen that before. Science is growing like never before. And I said before, there is no magical solutions for nutrition, but perhaps if we invest a little bit more on science and understanding how the gaps are, how can they be fulfilled, how can we deliver them, I think we could have in the coming years some magical solutions or some solutions that are produced by science, like these vaccines that we have for the pandemic that sounds like magic. Within a year, 9 vaccines that work. I wouldn't believe that 6 months ago. So I think we can do a lot if we put the money where we should, which is science and development. And if we invest in science, we are going to be able to understand better, John, that question. How can we deliver better products to the population that are going to be able to give them a better health?
That's really interesting, Oscar. I'm curious on what you see around the world. In the United States, for the first time, there are actually active discussions in the government now talking about how do you integrate all the interest in the agricultural departments and in the departments of health and human services. Because right now we spend something over $1 trillion, much more, in health policies and food policies that aren't connected. Yet they're directly connected in terms of health outcomes. And so now there's talk about a food czar that would come in the government and help pull together all these departments and agencies and spend in a way that could provide better focus of spend to do some of the things you just talked about, better research funding, to try to get at the answer and better preventive healthcare practices. But are there other countries in the world that you've seen that are already doing a coordinated effort within their countries?
If we have seen anything, is in general a lack of coordination throughout the last years. What I have seen working in science is a lack of coordination, not only between countries, but even within countries. A lot of repetitive efforts, a lack of conversation and openness. And I think this needs to be better articulated. We've seen that there can be articulated work, like we have seen with the vaccines that I was mentioning before. We have seen that we can actually do it. If we have the right investment, the right dedication, the right solidarity by individuals working on the scientific, the production, the marketing, etc., the policy makers. If we work all as a team, and if we have the clear goals, and the goal in this case for healthcare should be keeping people healthy, allowing people to maintain health, to return to health. If we have that in mind, maybe we will be able to invest far more on prevention and reap the benefits by having to pay less with cardiac surgery or pay less with drugs that are really not necessary if you follow a healthy lifestyle and you take care of your health.
Can we give our listeners hope that, look, even if you're on the worst diet, you can still change your health trajectory? You just got to do it soon enough and stay with it. I mean, what's that secret to get the right health trajectory for a great health span?
It reminds me of that yellow brick road, or that you probably know. There is a yellow brick road for all of us, and sometimes we walk away from that yellow brick road. But it's really never too late to start searching back for it and go back to that road that is going to lead us to us or to health in this case. I think what we have seen so far, and this is the study that we have done in populations like Framingham, Nurses Health Study, which are large cohorts in America with American citizens that were healthy, that were followed for many years. What we have seen is even people over age 50 or 60 that have followed a sedentary lifestyle, if they start doing physical activity, they can reap the benefits in later life. And it's the same for dietary practices. If you avoid being obese at middle age, and if you avoid it in later life, there are still benefits. Throughout your life, every day, we are taking a decision how we're going to live our lives and how are we going to die and when we're going to die. We say that there is nobody can predict when they're going to die. There is a matter of destiny. It's a matter of luck. But we have a big responsibility in the lifestyle that we are doing. Do we want to kill ourselves quickly? Then we need to follow an unhealthy lifestyle. Do we want to live as long as we should and as long as luck allows us? Then we need to have more physical activity and eat better. It's up to us. Every day we take that decision. It cannot wait, but it also never too late to make some changes.
Yeah. Awesome. I've heard actually you and others talk about, I've always believed this, the human body has been estimated to be built to last 110 to 120 years. Yet, the average lifespan is, or the death rates are hovering right around the low to mid 80s, I think. And so that gap between what the body is built for and when the majority of people seem to be dying, that's kind of like is that going to be the result of the improvement in health span, or what's the reason that the gap is, and how much of that do you think we can improve by changing our habits? Can we get 10 more years out of that gap, or what's it look like?
I think the body is not programmed to live up to 100, maybe up to longer. I don't know if Methuselah really existed. Maybe the guy did exist. Maybe we actually can live until 1,000. I don't know if I want to live more than 100 myself, but I don't think the body is scheduled to die at one particular age. I have seen it myself that what we do is going to determine our health. This year, when the pandemic started, I started working from 6 o'clock in the morning to 1 o'clock in the morning, day and night, never ending, including the weekends. And after a few months, I realized that I got dizzy, I started feeling bad, my blood pressure was up the roof. I wasn't taking care of myself, and I saw it on a direct basis. And I realized, and I got an urgent call, that if my body is scheduled to live for 80 or 100, my activity, my lifestyle, my poor diet, my lack of rest, etc., is going to kill me at age 50 and 46, and I'm already almost dying. Do I want to kill myself? So I started changing my lifestyle in the way that we continue working in the pandemic, working very hard, but trying to take care of my diet, trying to eat fruits and vegetables, trying to do physical activity. So I try to incorporate, I go for a run 5 times per week. And I also, one aspect that we tend to forget is that body and mind are very strongly connected. And quite often we don't take enough time to take care of our mind. And sleeping well and are allocating some time for reflection. In my case, I'm doing half an hour meditation. Every day I kind of do at least half an hour that I fit between my work. And now I feel that I can do the work that I was doing in March, in April, when the pandemic started. But with my physical activity, with my good diet, with my meditation, I'm feeling that I'm doing a lot better work. And I am being able to cope with it, and my blood pressure is back to normal. It's those decisions every day that is killing us. I don't think I don't think our body is scheduled to die at one particular age. We kill ourselves.
Yeah. Oh, good insights, Oscar. So, what you're talking about, I guess I would describe as happiness. And, and I look at, more and more companies are hiring people and giving them the title of, Vice President of Happiness. And even your title is Director of the Institute of Social and Preventive Medicine. So what a great job title, to be in charge of a social component. But define that a little bit. And can you give us a link of social to happiness, and then also social determinants of health? What's that key? You just alluded to it. Like, let's not kill ourselves. And part of that is that social component. How can we better manage that? Just the way you just described it, or are there other insights that you picked up from different studies?
The social component is essential. Human beings are social animals by nature. We need contact. We need families. We need friends. We need to have a community. We need to be able to feel that we are respected, that we can contribute, that we can serve. We need to feel that we are approved. We have seen an explosion in social networks. People in Instagram posting pictures of what they eat or how beautiful they look like. And if they don't get enough likes, they get depressed. We have seen really a pandemic, if anything. Besides of disinformation and of coronavirus, we have seen a pandemic of looking for instant gratification. I post things on Facebook or I post things on Instagram or on Twitter, and if I don't get enough likes, I get depressed. I think happiness, and this is more of a philosophical discussion that we could have, John. I think for me, happiness is feeling myself useful in life. And therefore, I feel that I can reach happiness by serving. By serving, because as a social person, as a social member of a community, I feel I have a responsibility towards the rest, not only to my family, but to the population in general. And I think that is the key to find happiness, is the moment that we as human beings, we can start serving a purpose in our life. Encountering that and finding that purpose is what is difficult to many. But I think as social beings, we need to promote that as elements of change, as elements of happiness. There are the societies, the communities, the families, etc. And keeping yourself healthy and keeping yourself alive is the way that you serve your family. If you die, you will be of no use to your daughters. But if you are still alive and healthy, you will be able to go for a run with them and enjoy a walk in the park. You have to choose. Do you want to be useful, or do you want to be a burden, or do you want to die?
Yeah. Wow. Well, I have to admit to our listeners, Oscar, that I've learned a lot about happiness and social skill sets from you. Every time we're together, you introduce me to a great tasting wine or some great chocolate, or even a couple times when we were in the UK together, the best bangers and beans, if you can believe that, in all of England. So I have to say thanks for teaching me about being happiness. But tell us a little bit about your insight. I know you're a big American football fan. Does that keep you happy too? And I've shared probably 6 NFL football games with you across America since the time we've known each other. Is that your sports fashion? Which is odd for me, because I thought it would be European soccer.
So, John, I grew up playing soccer, and soccer used to be the passion of my life. But when I was 16, I went to live in Australia and I experienced rugby. And I played rugby in Australia, which I really like, until I came back to Colombia and I watched a game it was the Houston Oilers versus the Redskins, as far as I remember. This was 1991, and I was amazed by the quarterback. Because in rugby, you cannot pass the ball forward. And it took me a long time to understand the rules of the game, but then I became a fan of American football, and I became a fan of the Dallas Cowboys. As you know, I'm a big fan of the Dallas Cowboys. I used to say with pride in that time, and now it's a little bit more of a regret, because the last seasons had not been the best for the Cowboys. But I found a lot of other aspects of the game that I really enjoy in American football, which is the strategy and the effort, the team spirit, the interaction between the different sections of a team, and how your attack is not enough if you don't have enough defense or special teams that are well prepared. And it's that balance that really has shown me that this is right now for me, I think, the favorite sport that I follow. And I enjoyed this season despite that the Cowboys did not do well. But I forecasted that it's gonna be Kansas versus Tampa Bay, and I've been a big fan of Tampa Bay in the time that they won the Super Bowl many years ago, but also Kansas City, because I really like their quarterback. But it was a fantastic season, I thought, despite coronavirus and despite of the disruption. So I think in those kind of things, like activities that you can do, not just watching sports, but practicing sports, is a way to find happiness. And I think happiness is not again, not something impossible to achieve, but it's a collection of little habits, domestic issues, being with your family, enjoying your life, enjoying a good Thanksgiving 3 games that you can watch in a Thanksgiving day in America, or enjoying a good Sunday football night, or a Monday night football. Those are part of living a happy life, I think.
Awesome. And on that note, some great advice for all of us, Oscar, is how to be happy, get a strategy to keep you happy, and some hobbies and activities to keep that spark alive in our lives. Dr. Oscar Franco, always a great pleasure talking to you. Thanks very much for the insights and the difference that you're making in the study of public health, and especially during this time of helping the world achieve a healthier health trajectory. Oscar, thanks for joining us. Great talking to you.
Thank you for joining us here at Chippa Chat. For more information and to hear our entire catalog of shows, please visit chpa.org.